Up to 1 billion people around the world do not get enough vitamin D, and there's a good chance that you are one of them. Even though we call vitamin D a vitamin, it's actually better to think about vitamin D as a hormone or as a prohormone. This is because vitamin D has a structure that is more similar to a sex hormone or an adrenal hormone than a vitamin. And very similar to other hormones inside of your body, it plays a key role in regulating multiple organs and systems. Another reason to think about vitamin D as a hormone instead of a vitamin is because it helps you understand how important it really is. By now, you're probably well accustomed to hearing about the importance of vitamin D, but how many of you are taking that advice seriously? How many of you are exposing 40% of your body to sunlight each and every day? How many of you listening to this have had your vitamin D tested in the last 6 months? And how many of you are taking a vitamin D3 supplement right now? Not enough of you, that's for sure, and that's why I'm going to spend the time explaining to you why it's so important. Unfortunately, the symptoms of vitamin D deficiency can be hard to wrap your head around because they can be so nonspecific. In addition to being vague, having the symptoms of vitamin D deficiency doesn't actually guarantee that you have the deficiency. And that's because the symptoms of vitamin D deficiency have a lot of overlap with other medical conditions and other diseases. I'm going to tell you more about what these common vitamin D deficiency symptoms are in just a second, but instead of focusing on them, I want to spend more time on the unusual and more serious consequences of vitamin D deficiency. You'll understand what I mean in just a minute. But back to the more common symptoms for a second. They include things like frequent illness or getting sick all the time, fatigue or low energy, bone loss, muscle pain, skin issues, and depression. While these symptoms are not ideal and may negatively impact your quality of life, they may not be enough to get you to take your vitamin D level seriously. But if they aren't enough, then I think these conditions will be. Number 1, vitamin D deficiency increases your risk of developing autoimmune diseases of all types. Put simply, if you don't have enough vitamin D in your body, you are putting yourself at risk for auto-destruction of your own tissues and your own organs. This is exactly what autoimmune disease is. Your body misidentifies your own tissue as an enemy and attempts to kill it over time, just like it would a virus or a bacteria. Autoimmune disease can lead to serious side effects and consequences that can negatively impact your quality of life over time. There's significant evidence that links vitamin D deficiency to multiple autoimmune diseases, including diseases like MS, rheumatoid arthritis, diabetes, inflammatory bowel disease, and lupus. This is why, by the way, that patients who have existing autoimmune diseases end up taking high doses of vitamin D in an effort to treat that problem. But in your case, if you don't have an autoimmune disease, it makes a whole lot more sense to take vitamin D proactively to try and prevent these autoimmune diseases from occurring rather than treating them if they already exist. Number 2, vitamin D deficiency increases your risk of developing hair loss of all types. If there's one symptom that people take seriously, it's hair loss, and I totally understand why. Hair loss can have a significant impact on your quality of life and your self-confidence. So if maintaining your hairline is important to you, then your vitamin D status should be important to you as well. We know from studies that vitamin D deficiency has been linked to 3 different types of hair loss, including telogen effluvium. This is the type of hair loss that occurs usually due to a stressful event and results in excessive hair shedding over the entire body. It could be the fact that when your vitamin D level is low, your body is less resilient to these stressors, which means that when you interact with these stressors, you put yourself at more risk for developing telogen effluvium. The second is alopecia areata, and this is an autoimmune form of hair loss. This is probably the most difficult type of hair loss to try and treat, so it's definitely the most important to try and prevent. The third is a special type of hair loss called androgenetic alopecia, or male pattern baldness. This type of hair loss can occur in both men and women, and we know there is a link between low vitamin D levels and the development of this type of hair loss. I wouldn't consider vitamin D supplementation a true hair regrowth supplement, however, it is very good at preventing hair loss. Number 3, a deficiency in vitamin D means you are much more likely to be overweight. Believe it or not, there appears to be a connection between your weight and your vitamin D status. There's no question that people who are already overweight have a much higher time increasing their vitamin D level with supplements and/or exposure to the sun. This is because vitamin D is a fat-soluble vitamin, much like vitamin A, D, and K, and if you have more fat on your body, there's more places to store it. As a result, if you are already overweight, you will need a higher dose of vitamin D to saturate all of the fat and tissues in your body. What's not so clear though is whether or not vitamin D deficiency directly causes weight gain or if it's just a single one-directional relationship. In other words, is it just that being overweight makes it more difficult to manage your vitamin D, or does vitamin D deficiency directly cause weight gain? This is still being studied and established, but we do know from 2 large studies that patients who have a low vitamin D level gain more weight than people who have a normal level. When you start thinking about vitamin D as a hormone as opposed to a vitamin, and its impact on multiple organ systems and tissues, it becomes plausible that there may be a direct connection between low vitamin D levels and weight gain. But even if there isn't a direct connection, managing your vitamin D level is actually really easy and cheap, so there's no reason not to do it. Number 4, vitamin D deficiency increases your risk of developing certain types of cancers. Unlike the connection between obesity and vitamin D deficiency, the connection between vitamin D deficiency and cancer is much more fleshed out. Low vitamin D levels are associated with an increased risk of breast cancer in women and prostate cancer in men, and this is really just the beginning. One study highlighted this perfectly by stating, quote, "The high prevalence of vitamin D deficiency, combined with the discovery of increased risks of certain types of cancer in those who are deficient, suggests that vitamin D deficiency may account for several thousand premature deaths from colon, breast, ovarian, and prostate cancer annually." This suggests that managing vitamin D deficiency is a super simple, easy way for you to mitigate your own personal cancer risk. So if cancer risk is something that concerns you, and it should, then optimizing your vitamin D status should be a priority. You can opt to take the free route by simply going out in the sun each and every day, or you can take the slightly more expensive route by taking a vitamin D3 supplement every day. For those who like a more scientific explanation for how vitamin D deficiency helps prevent cancer, it works by blocking tumor blood vessel growth, known as angiogenesis, by enhancing the communication between healthy cells, by limiting the proliferation of cancer cells, and by maintaining healthy calcium levels in certain cells in the body. Number 5, vitamin D deficiency is associated with both type 1 and type 2 diabetes. This is because vitamin D plays a key role in regulating insulin secretion from the pancreas, which means low levels of vitamin D increase your risk of developing insulin resistance. And because vitamin D deficiency results in inflammation and higher levels of inflammatory markers. This sets the stage for developing type 1 diabetes, which is primarily mediated through the autoimmune pathway, and for developing type 2 diabetes, which is more inflammatory based. Diabetes and insulin resistance not only increase your risk of death from multiple causes, they also significantly decrease your quality of life. Current estimates suggest that up to 40% of adults in the United States have issues with insulin resistance, making this a massive problem. Taking vitamin D is not going to reverse your diabetes, but combining it with a healthy diet, carbohydrate restriction, fasting, and regular exercise, it's definitely going to help. There's even some evidence to suggest that type 1 diabetics who take vitamin D see a more balanced blood sugar level, indicating that there's a direct connection between blood sugar and vitamin D level and function. And number 6, vitamin D deficiency increases your risk of developing pain syndromes. One of the most basic symptoms of vitamin D deficiency is that of muscle pain and muscle weakness, as I mentioned previously. And a big part of this connection has to do with the processing of pain inside of the brain. When vitamin D levels are low, you're much more likely to experience an augmented sense of pain. You can think about it like this. Imagine stubbing your toe if you have a headache. Now imagine stubbing your toe if you just found $1,000 on the street about 2 minutes before. Both scenarios result in the same amount of pain, but your personal perception of the pain is different in both cases. Being low on vitamin D is like stubbing your toe with a migraine. It's just going to make everything a lot worse. The pain is the same, but your perception is a little bit different. The bottom line is that there are some very serious consequences associated with vitamin D deficiency beyond those normal low symptoms that most of you have already heard about. The good news is that it's not that hard to replace a low vitamin D level and mitigate or reduce your risk of all the things that we've talked about so far. In a perfect world, you'd be able to get all the vitamin D that your body needs from the sun, but if that's not possible, you can always make up the difference with supplements. Taking just 2,000 to 5,000 IUs of vitamin D3 each and every day should bring you out of that deficient range and reduce your risk of all of the things that we've talked about so far. And if you want to learn more about how I personally recommend increasing vitamin D levels quickly, I'd recommend checking out this video next.